A revised guideline on COVID-19 testing, quarantine and isolation has been released on the 3rd of June 2020. It's as per Government Order number 31/F2/2020/Health. This has been done to bring clarity to the issues of testing by the different methods available presently. We now have three methods of testing for COVID. One is the conventional or well-known RT-PCR test. The second is the pooled RT-PCR test. And the third is the gene expert or TrueNAT testing method. In order to know which test has to be applied to which category, the present order contains a matrix of 15 different categories. Among these 15 different categories, 11 categories are eligible for RT-PCR testing, 3 categories for the pooled RT-PCR testing, and 1 category for the gene expert or TrueNAT testing. Now we will see which are the 15 categories mentioned and the test specified for each category in detail. Category number 1, all symptomatic patients who have undertaken international travel or interstate travel in the last 14 days. For them, RT-PCR is the recommended test. Category number 2, all symptomatic contacts, whether primary or secondary, of the lab confirmed cases are eligible for the RT-PCR testing. Category number 3 is the asymptomatic primary contacts of a laboratory confirmed case. These people are eligible for the pooled RT-PCR testing that has to be done on day 8 from the last contact. Category number 4 is all patients with severe acute respiratory illness, which is commonly known as SARI, SARI. For them, RT-PCR is the recommended test. Category number 5 is all individuals with influenza-like illness, ILI, who belong to the containment zones. For them, RT-PCR is the recommended test. Category number 6, all guest workers or what we call migrants with ILI. For them, RT-PCR is a recommended test. Category number 7, all hospitalized patients, that means hospitalized for non-COVID symptoms, who have now developed ILI symptoms. For this category, RT-PCR is a recommended test. Category number 8, all symptomatic healthcare workers, frontline workers, which includes community volunteers, police personnel, ASHA workers, etc., who are involved in the containment and mitigation of COVID-19, who have now developed an ILI symptoms. They are eligible for the RT-PCR testing. Category number 9 deals with influenza-like illness family clusters. That means 2 or more cases, and also influenza-like illness in high-risk population, which means those aged more than 60 years or persons with known comorbidities, antenatals and immediate postnatal women. For this category, category 9, the test applies RT-PCR. Category 10 deals with prisoners, asymptomatic prisoners brought to jail after parole, or asymptomatic new prisoners who are brought to the jail for admission to jail are eligible for the pooled RT-PCR testing. Details regarding this category are available in GO number 31/F2/2020/Health dated 20th of May 2020. Category number 11 is for people who are eligible for the expert TrueNAT testing. This includes 5 divisions. A is symptomatic antenatals who are COVID suspects. B is asymptomatic antenatal or pregnant women who have a travel history outside the state, and that is to be done between day 5 and day 14 after the arrival in Kerala. Subdivision C includes any COVID suspect in whom an emergency surgery is being planned. Category D includes any COVID suspected death where samples are required for testing in order to undertake further actions. And category E, the 5th one here, includes any sick patients with severe acute respiratory illness for whom an early test results has a role in the continuing clinical management. So these 5 divisions are situations where we need a fast result, so they are eligible for the gene expert TrueNAT testing. The results are usually available within a period of 1 to 2 hours from sampling, whereas the other conventional RT-PCR might take anywhere between 24 to a maximum of 48 hours. Usually it's available within 24 hours, but it might stretch up to 48 hours where the lab load might be higher than anticipated, or maybe some ambiguity has happened in the results or the running of the test. Category 12 are the patients coming from a containment zone and presenting a stroke in the young multivessel or large vessel Kawasaki-like illnesses, multi-system inflammatory syndromes, hyperinflammatory shock or toxic shock syndrome-like illness in children, and also acute myocardial infarction. The test to be applied here for this category number 12 is RT-PCR. Category number 13, any patient posted for an elective surgery. The recommended test for this category is the pooled RT-PCR testing. Category number 14 is a symptomatic contact of an international or interstate traveler in the last 14 days. For this category, the recommended test is RT-PCR. Category number 15 deals with follow-up samples. A patient who has been hospitalized and confirmed, the first follow-up sample has to be taken on day 7 from the date of the first positivity. Subsequent follow-up samples are to be sent 48 hours or 2 days apart. And once the person turns negative, then the next follow-up samples are to be taken after 24 hours. The recommended test for these people is RT-PCR. The government order referred to earlier also contains a isolation and quarantine matrix with 4 main subdivisions. First subdivision is any laboratory confirmed case of COVID-19. The recommendation is 14 days of home isolation from the day of discharge. That means after 2 consecutive negative follow-up samples taken 24 hours apart, which is the requirement for a discharge. The second category is the people who have undertaken international travel or interstate travel in the last 14 days, and also the primary high-risk contacts. For both these people, the recommendation is 14 days of strict home quarantine or room quarantine, followed by 14 days observation for symptoms for all members in the home quarantine. During the observation period, they are required to avoid all non-essential travel and also practice strict adherence to the break the chain components like mask use, personal and hand hygiene, cough and sneeze hygiene, and social distancing. Any symptoms which occur during this period should be reported to the authorities either through Disha or through the local health workers' telephone number. The third category, there are 2 divisions. One is the primary low-risk contacts, and the other is the symptomatic healthcare workers with contact with a confirmed case with a breach in the PPE, which means the PPE was not worn properly or it was noticed that there was some leak in the PPE. And this is even if the patient was tested negative. The quarantine recommendation is 14 days of home quarantine. Any symptoms during this period should be reported to the health authorities through Disha. The fourth category is for one is secondary contacts, or also local contacts of people who have come from countries or areas with community or local transmission. The recommendation for this group is, for the next 14 days, avoid all non-essential travel, restrict your movements, and practice strict adherence to mask use, personal and cough hygiene, hand hygiene, etc. Avoid community and social contacts, and if any symptoms develop during this period, report them immediately to Disha. Now, just to have some refresh some definitions, what is a primary contact? Any person who has been in contact with a laboratory confirmed case of COVID-19 is a primary contact. What is a secondary contact, or who is a secondary contact? Any person who has come in contact with a primary contact is a secondary contact. What is meant by high-risk contact? Contact with a confirmed case of COVID-19 or a traveler who has visited an area where COVID-19 patients are being treated, or a person who has traveled to a locality where active COVID-19 community spread is suspected, or clustering of confirmed COVID-19 cases has been detected in the last 14 days. Or a person who has tested the body fluids of patients, which includes respiratory tract secretions, blood, vomited fluid, saliva, urine, stools, etc. Or a person who has had direct physical contact with the body of a patient. This includes a health worker who has done a physical examination without using appropriate PPE kit or PPE components. Any person who has touched or cleaned linen, clothes or dishes of the patient is a high-risk contact. Any close contact within 3 feet or 1 meter of the confirmed case is a high-risk contact. And also co-passengers in an aircraft or vehicle who were seated on the same row, and also in an aircraft 3 rows in front and 3 rows behind of a person who was later confirmed as a COVID-19 case. So these are the high-risk contacts. The low-risk contacts, there are just 3 categories. Low-risk contact is a person who has shared the same space, which includes same classroom, same room for work or activity like work, and not having any kind of the high-risk exposures which we mentioned earlier. The next group here, low-risk contact, is the travel in the same environment. The person has traveled in the same environment, which means something like a bus or train, but he or she did not have a high-risk exposure which was not mentioned earlier. And 3, any traveler who has not satisfied any of the high risk criteria is a low risk contact.